Okay, so we've just ticked over to 12:30, so I might get started. We are recording today's session, and we'll have some people coming in as we go. So I'd like to start today's webinar by acknowledging the traditional custodians on which we're all meeting from today. I'm coming to you from the Yagara and Turrbal People's Land in Meanjin. I pay my respects to elders past, present, recognising their continuing connection to land, sea, water and community. I also extend this respect to any First Nations people joining us today. So as I mentioned, the session is being recorded today. You would have noticed that your cameras and microphones are off by default. We are using the Q&A function, as you'll see at the top there of your screen. If you're not able to use the Q&A for any reason, please just raise your hand during the question time at the end. So we will have questions at the end after the presentation. Now, I might hand over to you, Greg. Thank you very much for joining us.
Thank you so much, and appreciate the opportunity to talk to you today, and also Carolyn, representing the Greater Choices at Home Palliative Care Program and the PHNs, and also, representatives from the aged care sector. I think this is a really important, but I think positive session in the sense of how we can use the available tools and resources to really foster good outcomes for the people we care for. I think taking into account also now that there are strengthened aged care standards that defines the road ahead. My name is Greg Parker. I'm a palliative care physician. I'm based in Brisbane, and I'm talking to people across the state, and I'm not sure if we've got anyone on from outside of the state, but I'm clinically based. I actually work with the palliative care service, the Metro South Palliative Care Service in Brisbane. I'm also come from a general practice background and work with an amazing team of clinicians and support staff. I wear the hat in the Queensland space as the co-director of the Office of Advanced Care Planning, which is a Queensland Health and government initiative to support coordinated, systematized, structured approach to advanced care planning for the community, but also supporting clinicians. And I think the game changer for us, and this is an Australian first, is being able to ring fence documents that people send to the office, doing quality checks and having a repository that's visible to clinicians across the state. I also wear another hat, which is Director of Advanced Care Planning Australia, which is a Commonwealth palliative care projects initiative, and work with an amazing team in that space. And our objectives there are really creating awareness across the country around advanced care planning for the community, supporting, educating and skilling clinicians and aged care sector clinicians, as well as other health professionals in having that ability to support people to partake in the process of advanced care planning, but also understand the nuances, and then also look at system level approaches and advocacy. We've been doing a lot of work with the Aged Care Commission around specifically advanced care planning, but also at a local level. So my talk is going to run for the duration of the session for an hour, around, just to give you a helicopter view, around really broad outline of the rights-based approach that the strengthened standards take, a broad overview of the specific area that covers advanced care planning, and then I'll do a deep dive, and I want to make this practical for each component and subsection where advanced care planning is focused on, as to how you can connect the tools and resources at a local level to support you in your processes in your area in delivering that care and ensuring that the people, the community that you're caring for, and it's agnostic of where they are. Is my impression is really how we then support them to have a voice and at least be able to talk about their preferences and choices in delivering healthcare that's relevant to them into the future. So I'm going to share my slide set to start off with. And if you can't see it, please let me know. Should be visible to you now.
Yes, that works. Thank you.
Okay, and please stop me at any time. I would suggest just to maintain continuity, if you can post your questions in the chat, and maybe we can answer some questions at the end. And also, I think there is the opportunity to converse as well. So it's really about the strength and standards, as I said, where I'm from. Just to give you an idea of the office, we are in the state of Queensland, the Office of Advanced Care Planning. It's been going since 2017. It's really focused on pulling together a coordinated, structured, systematized approach to advanced care planning in the state. As I said, it's a first in Australia, providing information and resources about ACP. I'll show you the web pages, the ability to receive ACP documents, to be able to quality check them and then create visibility of them through an electronic medical record, the viewer, which is visible and available to anyone that's APRA registered, no matter where you are within the state, to give that real-time clinical decision-making, including first responders, which is QAS. Having the ability to upload the documents to the tracker, and also sharing a patient's wishes with clinicians across the care continuum, and having the ability to notify primary care providers, but then also connecting consumers to ACP services in their local areas. I think the important context and glue really for the key changes in the Aged Care Act that's come through is this rights-based approach. Having now registered supporters, talking about supported decision making and what those strength and quality standards look like. So I think they're really key focus points and considerations with respect to advanced care planning. So a rights-based approach, I think, just to refresh everyone around what that means, it includes the right for a person to make their own decisions, have their decisions respected, get the information and support they need to make those decisions, communicate their wishes, needs and preferences, feel safe, respected, have culture and identity respected, and being able to be connected with community. And really those are core elements when we start talking about advanced care planning, which we need to consider. These are the strengthened aged care standards, just to refresh your view of it. We're really going to focus on the section which I've highlighted, and there are elements of advanced care planning that's built into some of the other segments, but I want to focus on standard 3. I understand who I'm caring for and what is important to them. Now, I want to unpack that with respect to advanced care planning. And it's really giving you the tools to work out how this fits into your processes within your organization, but also just in terms of how you can support staff and the people that's been cared for to have that connectedness when it comes to advanced care planning processes. So these are the strength and quality standards related to advanced care planning. I think they're and I'm not going to read all of them in the interest of time, but I think it's important to recognize that the action item around this is the provider has processes for advanced care planning. It's the processes that's important. Supporting the individual, which is really critical, and the essence of all of this, and then it lists the points. Just a reminder of what advanced care planning is, and this comes from Rebecca Sadora and them's work. It is really a voluntary iterative process that can happen over time. The earlier, the better to avoid crisis situations, but it's voluntary and it depends on the circumstances for the individual. They can engage in all parts of advanced care planning processes or some of it. There is no sort of right and wrong in this space. It supports adults at any age or stage of health to in understanding and sharing their personal values, their life goals, their preferences regarding future healthcare and medical care. Okay, and it's ensuring that people are able to at least receive the care that's consistent with those values, goals, and preferences. I think it also includes knowing what and who matters to the individual, especially, and who they then trust to be their voice when they're unable to communicate, especially at that critical decision-making point. I think it's important just to acknowledge that this can be very personal and visceral, and it's not something that inherently happens for people. There's I guess a sensitivity sometimes and skill around drawing out the conversation. It is person-led. I do need to emphasize that. Advanced Care Planning Australia did a recent prevalence study looking, and I encourage you to go onto the website looking at various aspects of advanced care planning processes that community is involved in, and it was a representative sample of the population across Australia. I think it's important to recognize that only 1 in 3 adult Australians have engaged in advanced care planning. So let's do a practical dive into this. So the first part is, how do we support the individual to discuss their future medical treatment and care needs that aligns to their goals and preferences? What are our processes, and what can you draw on that will help you to be able to fulfill that component of this standard? So I think thinking in broad terms, when we look at the individual we care for and their support and their family, how do we engage in the conversation is really important. And I think we need to think of it in broad terms. It's not only about the physical symptoms or condition of the person, it's taking into account their emotional, mental, spiritual, cultural, social connections as well. And a colleague, Harvey Chokanoff, is a psychiatrist and palliative care physician, and he talks about, what do I need to know about you as a person to be able to give you the best care possible? And you would be surprised how that opens up a range of thinking points, and it's how you frame that in a sensitive and appropriate manner. These are the tools. So what I would encourage is have resources pointing to how you would do this and create awareness. Go onto the Statewide Office of Advanced Care Planning's website, and we're happy to share all of this. There are ample resources, conversation starters. There are tools to support starting the conversation. The same on Advanced Care Planning Australia's website. There's resources for professionals from a health and aged care professional perspective, as well as also for the consumer. So, have that available to be able to point staff to it and also people that's being cared for. I just want to mention here specifically with staff training, because it's not straightforward, and I think it'd be nice to have, not nice, but I think prudent to have those skill sets and at least have resources that people can draw on to build their skill and ability to start the conversation. There are micro-learning modules on Advanced Care Planning. They're all free on Advanced Care Planning Australia's website that you can register, do at your time. They're quick, they're easy, and they graduated, taking you through various components from the word go in terms of how do I think about it, what's available, through to having those more complex conversations. And as I said, they're free, they're online, they're 10 to 15-minute quizzes. And they're really great to go through. So thinking about advanced care planning, this is bringing it down to the individual, but how are our staff, how are we positioned to be able to start the conversation? And I think being patient-led is and person-led is one component, but also I think leading it in terms of us as health professionals and aged care staff. How do we engage and consider supporting the conversation? So I think importantly, what matters most to the individual is one component. How do they make specific instructions if they want to? What are the tools available? And then who do they want to be able to speak for them or be their advocate if they lose the capacity to be able to make decisions? Really critical. I won't go into playing the YouTube video, but it gives an idea of how substitute decision makers work and also the responsibility that's on them. It's not an easy, straightforward appointment. I think it's important to recognize it comes with responsibility. Conversation starters are really important, and that comes through from Advanced Care Planning Australia's conversation starter cards, and I encourage you to access that and have the opportunity within your areas to be able to use those, sort of have ability to use them to start conversations and test the waters and see, do we need to build skill here? Do we know what else we need to draw in on to be able to get comfortable with having these conversations? Because it doesn't come easy. And look, I've been doing palliative care now for the last 20 years, and you always find situations where conversations are not straightforward, and sometimes you have to nuance and be nimble to be able to come to a point where you can have those harder conversations, but it takes time and it takes practice. So if individuals want to complete documents, and this is if they want to and they choose to, the Commission's been very clear around this is voluntary, and some people may elect not to do this, and that's fine. But I think where it's important is for us to ensure that we give people every opportunity and in a safe space be able to engage in the advanced care planning process if they want to. So some people may go ahead and say, look, we don't want to write anything down as long as we've had this conversation and you are aware and we've chosen a substitute decision maker, whether it be my friend or my partner or my son or whoever. They know what I want. The important thing is giving opportunity. But there may be people that says, right, let's write it down. And there's nothing wrong with being able to capture this information. Keeping in mind that within the Queensland context, there are statutory documents, and I'll go through those now, and others which indicates value. So there's directional documents, there's enduring power of attorney documents, and then values-based documents as well. Queensland's governed by the following relevant laws that really dictates this component. It's the Power of Attorney Act, the Guardianship Administration Act, and the Public Guardian Act. Look, I encourage you to read it. They are long and very, very technical, but I think the important thing to take home from this is that there are clear laws and legislation that governs advanced care planning and the mechanics and elements that makes it up within the Queensland context. Documents available within Queensland, and again, I'm giving you the tools for you to be able to address that subsection of that standard. There is the Advanced Health Directive, which is the statutory document or enduring document. There's the enduring power of attorney, and then the statement of choices. The first two are legally binding and enforceable if they are completed correctly. I say if they are completed correctly. The statement of choices although it's not legally binding or enforceable, it does provide a tool to support decision making and the conversation, especially when it comes to that critical and clinical care that's required. So some people would say, well, why complete that then? It's about preference and giving people choice. But I think the important thing is that you can't ignore these. And some people may want to complete all three, others may want to only complete one. I think the important thing is it gives people choice. So the Advanced Health Directive, as I said, is legally binding. It applies in particular circumstances. And I think so if you go onto our Office of Advanced Care Planning webpage and also the DJAG's webpage, there's clear instruction and guidance as to when these kick in, how they completed, and when they take effect. The enduring power of attorney allows you to legally appoint a decision maker to support your decisions when you lose capacity and advocate for you as if they were you, not in terms of their thoughts or what they think should happen, but echoing what your thoughts are, and those discussions having happened earlier. And then the statement of choices, there's two forms. There's a Form A for those people with capacity and those who have lost capacity or with impaired capacity. And it really provides a tool for conversations to happen and decision-making to happen, and guides those clinical decision-makings and the substitute decision maker when that critical time arises. This is just a brief outline, and look at this is all that you can use to support your processes. And I think having this available at your local level is really of value. So this gives a rundown and a quick summary of what those maintain and are consisting of. I just want to make a mention of acute resuscitation plans, because ultimately you find that the advanced care planning conversations that happen early on informs really those goals of care discussion that happens down the track and in those individual intersects when situations occur, when someone becomes suddenly ill or their condition changes. And then also in that critical times when you really need to start talking about acute resuscitation planning, what is our ceiling of treatment? What are we going to do if you deteriorate and suddenly we need to consider, is IV antibiotics appropriate, is CPR appropriate, is transfers to hospital appropriate for other interventions like inotropes and etc. But those are really the crux of it is having those conversations early on in the piece informs how this plays out downstream. I just wanted to let you know there are guidelines, and happy to share that with you. There is a link to a guidelines that sits with Queensland Health. The acute resuscitation plans can be completed in the hospital setting and the community setting. And they're an important component of that suite, that bundle that will inform clinical decision making in the circumstances that is warranted. So just again, a summary, whether it comes from Advanced Health Directives, enduring power of attorney, statement of choices, using those ACP documents to guide goals of care discussions and acute resuscitation planning to inform then treatment processes, including withholding and withdrawing life-sustaining treatment when that time arises. Just want to make a mention about the relationship between voluntary assisted dying and advanced care planning, because voluntary assisted dying is a legal end-of-life option within Queensland. I think it's important to recognise the nuances and what it is and what it's not, and what's allowed and what is not. There's really a good video on that, and I've linked you to that in this presentation as well, that goes through and discusses it, and it's linked to end-of-life law. Through QUT, there are really important guidelines in that space. So we're getting there. The third part of this is another important component is, how do we support individuals to nominate and involve a substitute decision maker if and when they choose? Really important. Capacity. While the individual has capacity, they will make decisions. And capacity, I think, is important to recognize that in the Queensland context, a person is deemed to have capacity unless there are other concerns or it's proven otherwise. And I think it's important to also recognize that even though a person has impaired decision making, it doesn't necessarily mean that they've lost capacity. It depends on the circumstance, the situation, and the point in time, and what the capacity is required for. I would encourage you to have an understanding and also ensure that that health professionals and staff are familiar with the concept of capacity and in the context of advanced care planning. Capacity assessment guidelines. The department, DJAG, has really produced a really good suite of resources around assessing and understanding capacity. Now, I'm not saying that every one of us will be involved in these assessments. It depends on the circumstances, but at least to have a broad understanding about the concept. The concept of supported decision-making is something that has been really front and center within the New Aged Care Act. And I use the schematic and the diagram here to define that. So while the person has capacities, able to make independent decisions, they decide. They are the person that will be engaged. Keeping in mind, in terms of decision making, the context of being only able to verbally communicate is important to recognize that that's not the only way a person can communicate their decisions, and also a focus of capacity. People may be able to, for visually impaired people who are deaf, people who only have limited ability to communicate verbally, there are other options. And the new component of this is we need to make every effort to support them to be able to voice their decisions, to voice their preferences and wishes, so that we give them every opportunity to be involved. Because if I can't communicate verbally, doesn't mean I don't have capacity. Important to keep in mind. So the supported decision making is really important. And then ultimately going down the route of a substitute decision maker. And there's a guideline around that as well. And there's a lot of information. Craig Sinclair and their group has done a lot of work to develop these guidelines, and I'll give you an example over here. But there's also online consumer handbooks and support for health professionals and support workers. The Public Guardian has also produced really good resources to support that. The concept of registered supporters versus substitute decision makers will come into play, and I really just encourage you to ensure that you have an understanding around what a registered supporter is versus a person who will make decisions, healthcare decisions and otherwise, for a person who has lost capacity. Again, I won't go into detail, but it's important to recognize. Okay, just again, highlighting those points, and Advanced Care Planning Australia has a suite of resources to connect you as well with that, as does the Office of Advanced Care Planning. We also have a clear flowchart, and this is available to you to give you an understanding of the decision-making hierarchy. So what trumps what, and who do I talk to? Because many times you'll have different family members coming in, everyone wanting to have their say when a person's lost capacity. And sometimes they may not have clear documented evidence of who their substitute decision maker is, or that may be clear. But what is important from our perspective is to know who we engage with, who we talk to, and I'm not saying don't talk to others, but if decisions need to be made around healthcare, who is identified as that individual? And this gives that guidance. Within the Queensland setting, keeping in mind an advanced health directive that's been completed properly will trump everything else. And then there's a hierarchy around that. So I think it's important in terms of internal processes to be able to build that in. Do we know? Do we have clear instruction as to who we're going to talk to, or who do we engage in terms of that decision making? If Joe loses decision making capacity, is that documented and stored somewhere? So coming to the last part, ensuring that advanced care planning documents, if they are completed, are stored, managed, used, and shared with relevant parties, including at transitions of care. Now, I can't emphasize this enough. This is really critical, because the thing that arises in those critical situations is, where are the documents? Or they're sitting on a platform that it's hard to find it in. And also, if we have people, and there will be individuals where you're going to get first responders called QAS, or there's going to be a medical decision that needs to be made, or they're going to be transferred to a hospital, or there's changes that happens, or we need to go and access those advanced care planning documents to help decision making. Where are they? So you need to be able to have some processes in place that says we know where they are, but not only that, we're confident that these documents are right and meet legislative requirements within the Queensland setting, but also, if they're not, are they going to help us make decisions? There may be other documents like statement of choices, acute resuscitation plans, advanced health directives, enduring power of attorney. It's the whole suite that helps that decision making. And if a person's going to land up in hospital, or if they've been in another area, have we got visibility of that? So I think in the Queensland setting, we are very fortunate. We have the infrastructure to support that systematized approach. It's not available and free in any of the other states, but what we have is a repository where documents, if they are completed and they have been sent to the Office of Advanced Care Planning, they will be visible, uploaded, and I'll show you what it looks like, uploaded in a way that will be easily visible, not only to first responders, to QAS, who has access to the viewer, but also if people end up in hospital, they can see them. GPs can see them. If you've got APRA registration within so aged care nurses, pharmacists, they're all visible to clinicians, where it would be important for them to have those handy to make those decisions. So it's an online repository. It can provide real-time access to ACP documents, and health professionals across Queensland Health and primary care, residential aged care, and ambulance has visibility to them. The statewide Office of Advanced Care Planning accepts these documents, and they then review them and ensure that they quality check before they go on to the tracker. That just gives you an idea of the benefits of sending them through. The turnaround, if needs be, is usually within 2 days. They can have them uploaded and visible. And if there are issues with the documents, they will then send them back and also comment and guide what needs to be completed. And what we found is that that's old data. We've had 28% of ineffective documents being returned as effective, and I'll show you where we're up to at this stage. That's just links to the health provider portal, which you'll have available. And it's easy to register. Once you've got your APRA details, it's easy to be able to get onto the portal. And it not only has visibility of the ACP tracker, but there are other discharge summaries, pathology, appointments visible on the view as well. So it's got more benefit than just the tracker. And that's the two views you'll see. Just to give an example, so within discharge summaries that comes from the hospital, anyone who's had advanced care planning documents uploaded, that will be flagged. And if there's also the other advantage of this is if any conversations had taken place within a hospital or Queensland health setting, that will be captured in the comments section, and that will be visible as well within the tracker. Just to give an example, per month, and we're getting up to 1 million per year, essentially the tracker's launched about 90,000 times. So people are looking for the information and utilizing it. The structure is very clear. Also, just to mention, acute resuscitation plans are visible. It's got a clear hierarchy. It's date stamped. There's chronology, as well as comments that's visible. So it gives you that time line of discussions that happened and any documents that's current. And I'm not saying that's the only place. I think the other thing to keep in mind is people might want to hold on to it themselves. You may have systems internally where you've got it. There's My Health Record as well. But I think from a Queensland wide perspective, this gives you a central point where this is easily available and it's quality checked. So are people responding? Are people sending in their documents and making it visible? Over 200,000 documents are sent to the office. Over 170,000 are uploaded, which are effective. So the office receives about an average of 3,600 per month. The tracker is looked at on a regular basis. And also what we've been able to do is with the different documents, we can actually extract. We've got a database which we can actually, provide information about what sort of documents are sent in, what people's choices are, and these are de-identified but available. And look, there's been a lot of evidence now to show that if a person's advanced care planning documents are uploaded to a digital platform, the viewer in this case, 6 months out of them getting to a point where they have a terminal phase, you actually find the outcomes are better. People get the care they wish for. They spend less time hovering in hospital settings, and also their preferences in terms of where they cared for and where they died for are really married. So I think there is benefit in ensuring that we do support advanced care planning processes. Having said that, again, documents are only one part of it. It's the conversation that's important and how we capture that conversation. Again, just there's a whole range of areas where we can provide it for. I'm coming towards the end of the talk, but I think the important thing, you may say to me, Greg, well and good, you've told us this is what we have to look at as the standard. You've given us the tools, but we've got X number of other standards, other stuff to be involved in. Why is this important? I think it's around supporting family, the person and the healthcare team to contextually define and frame and operationalize true person-centered care. And we know that, things get to a pointy end, especially in those critical decision points when everyone is emotive and there's sometimes tensions that exist, and it's about being able to go back to that to say, this is what's happened, this is the decision making that we're going to apply, these are some of the reference points we're going to use to bring us onto that page. And you find that it calms the situation, but not only that, especially at the terms of end-of-life care, in bereavement, it really makes a difference. So I think it behoves us to take the time to do this early in the piece, but not only that, to continue doing it, because it's iterative, and a person's physiology will change, and what they thought would be appropriate at this point may change down the track. So we've got to keep reviewing that in a sensitive and culturally appropriate way. I think this is important to recognize. So this is just some data that's come through recently. In terms of total deaths in 2024, and this is Australian statistic, we can't get away from the fact that it is within that that aging group, going up from 65 over to 94. It's that population that this is really important, and people are talking. The community wants to be engaged and involved in what their future healthcare looks. They want their preferences and choices and their voice to be heard. So I think from our perspective, we need to support that. I think it's also important to recognize this is the top 5 causes of death, and we can see that essentially the blue line, the light blue line going up, is dementia. Now, I think it's important to recognize that early conversations are important. A person per se having dementia doesn't equate to them not having capacity, but I think it's important to recognize the urgency and critical nature in terms of what we need to do to support people as they move through their trajectory and journey in terms of progressing to severe dementia. Because by the time people have that point where they've lost capacity and have severe dementia, it becomes harder. You can still have the conversation with a substitute decision maker, but engaging the individual and hearing their voice is a different context, and makes such a difference. You can see the numbers are increasing, and this year we know now that dementia is the #1 cause of death. So just recapping. Advanced care planning is voluntary. It's about ongoing conversations. It's led by the individual. They may or may not wish to complete legally binding or other documents. And it's really for that time when the person is unable to communicate or make their decisions. I don't know if I can play this video. I'm just going to try, but Advanced Care Planning Australia, End of Life Law, and LDAC put together this video, which I think is worthwhile. It goes through some of the questions that may be on your mind. If it is possible, Carolyn, if you wouldn't mind, I'm going to try and play it and let me know. Sorry, it may not take, otherwise it is there in your slide set. Just give it a second to load. No, it does. Oh, maybe it's coming. Sorry, the internet's a bit slow. No. I'll let it hover for a bit. I may come back to it. We'll see if it can play. But it's worthwhile having a look at this when you get time, and it's in the link as well. It's really around talking about some of the common questions asked. Do I have to complete an advanced care planning document? Is it mandatory? Oh, there we are. Can I just check? Can people hear that?
Sorry, Greg, it looks like we don't have sound on.
No audio. Sorry. No, sorry. I
Would you
won't.
like me to see if I can share it with sound or
Yes, if
like after
possible. If
this?
that,
Yeah.
no, that'd be great. Thank you. I may just move on. I'm aware we've got 15 minutes left. Apologies about that. Um, So I think the important thing, just the take-home messages from this, is really around ensuring that we have a recognition and identify the standards that's relevant to advanced care planning, but then also be clear about the processes we can put in place to support this, and especially around A, B, C, D. And I think the other thing is also recognizing what resources are available, including, at a national level, but also at a state level and within your local area, and how we then also foster creation of champions within our areas to support this, because I think it's hard for everyone to keep track of everything that's happening. But I think having clear structure and support, and also someone that we can go to provide that information is really critical. And having the skills to support the communities we care for is really important. I've just got one or two more things. This is available on Advanced Care Planning Australia's webpage as well. End of life law, I would encourage you to have a look at the webpage. There are important things. I think health law is really something that is missed, and it doesn't matter whether I'm a support worker, whether I'm an individual clinician, whether I work for an organization. I think there's complexity around health law, and I think it's important for us to have a clear understanding in broad terms about some of the nuances and broad brushstroke principles around health law. And I would encourage you to look at that site. If you want to contact the Statewide Office of Advanced Care Planning, their details are on there. And there's also the National Advanced Care Planning Australia site. I'm going to park it there and take questions, and hopefully this has been informative.
That's wonderful. Thank you so much, Greg. Just opening it up, we don't have any questions coming through the Q&A just yet. But just wondering around, people have it in the chat. Don't think.
Is this helpful for you? Does it give you a framework and a structure to at least support what you've been doing? And again, this is only one avenue. I think, just to be clear, you may already have things in place to support you, and that's fine if it works, but this is to give you an outline. Sorry, Carolyn.
No, you're right. That's fantastic. Did you want me to share the video?
Yeah.
Give that a go?
Yeah, thank you.
Wonderful.
That'd be good. It
Thank
may
you.
answer some of the questions.
Are you able to see that come through?
Yeah.
Yeah, perfect.
Directives are a valuable tool for older people to document their future healthcare
Sorry, if I could just get a thumbs up or something from people. Yep, cool.
decisions. However, there are often misunderstandings about directives. Common questions. Must an older person have an advanced care directive? No, making a directive is voluntary. If an older person chooses not to make a directive, their choice must be respected. Aged care providers can't require an older person to make a directive to enter residential care. However, moving into care can be a good time to find out if the person wants to discuss their future healthcare preferences or make a directive. Can someone else make an advanced care directive for an older person? No. A directive is a legal document like a will. Only the person can make a directive. Family, substitute decision makers, and health professionals can't make a directive for the person or add information to a directive once it is made. When can an older person make an advanced care directive? This can occur only when the older person has decision-making capacity. Every state and territory has different requirements for having capacity. Generally, it means the person can understand the effect and consequences of their decisions, use, retain, and weigh up information, decide voluntarily, and communicate their decisions. Can an older person with dementia make an advance care directive? It depends on whether they have decision-making capacity. In the early stages of dementia, an older person might still have decision-making capacity and be able to make a directive. Having dementia does not automatically mean a person lacks capacity. When will an advance care directive be followed? Health professionals can follow a directive only when the person no longer has capacity to make the decision. However, in the Australian Capital Territory, a health direction can sometimes apply when an older person has capacity. Can a family member or substitute decision maker override an older person's advance care directive if they disagree with it? No. Family members and substitute decision makers cannot override an older person's directive. It must be followed and used to inform decision making, even if others disagree with it. Following an older person's directive respects the person's autonomy, choice, and dignity, and right to participate in decisions about their treatment. Does a health professional have to give an older person the treatment they request in an advance care directive? No, a health professional does not have to give an older person treatment they believe is futile or non-beneficial, even if the person requests it in their directive. Health professionals do not breach the law or other professional obligations if they do not give that treatment. Find out more information on advance care directives at these websites.
Awesome. Thank you so much. Anything else? We've got a few more minutes.
Yep, we've just got so we've got a question from Robin in the Q&A. It says, at a recent conference, I was told it is now illegal to upload an advanced care planning document to an aged care organisation's electronic documentation system. Could you please comment on this?
I'm not sure about the conference, and I actually can't comment. I would need to understand the context that was in. There is no restrictions if the organization's systems are clear and they've the infrastructure is there. I actually can't comment on that. It would depends on what context it was taken. I'd be surprised that someone had said it's illegal. So sorry, I can't help you, Robin. Do you know what conference were you at?
Sorry, Robin, I'm just enabling your mic there if you'd like to talk rather than chat, writing.
Thank you. It was a palliative care conference, and it was a throwaway comment from somebody who I think was trying to sell some sort of software. So it wasn't something that I was aware of, but I just thought there might be something I wasn't.
That's the complexity. I think there are so many, with all due respect, there are so many vendors and different people in the space, and I think it's important to fact check. I think don't just accept what gets said, and there's the Digital Health Agency. There's obviously the Office of Advanced Care Planning Australia, but I think it's important to fact check anything. And also, I think from the Commission, the Aged Care Commission's perspective, there's clear guidelines on the infrastructure that needs to be available to support the aged care setting, especially if it's residential aged care home as well. There's been clear guidelines around that as well.
And there are. Thank you.
Cool. Please feel free to raise your hand if you do have a question. Yeah. But I might just, if you don't mind, Greg, I'll just put up this slide here.
Thank you.
Oh, right, there we go. Oh, helps if it does. There we go. Just on today's webinar, we would like your feedback for future sessions. If you're able to please provide us feedback. You can scan the QR code, or I'm just going to put the link into the chat box as well. Greg, we do have another question from Shirley. Does advanced care planning need to be reviewed every 12 months?
Sure. I think it's an artificial parameter that's been put on it. I think advanced care planning, so the documents themselves are, if documents are completed, are there's no time stipulation. In terms of having a conversation and discussion with the individual, I think it forms good practice and makes good sense that if there's any changes in the individual's condition, if there's been any circumstance changes in terms of they've lost their partner, or they've elected, or they've chosen someone else as their substitute decision maker, or they've had a hospital admission, to go back and I think sensitively review what they still consider matters most to them, and if their advanced care planning context is still appropriate for them at that point in time. So it could be a couple of months, it could be 2 years, it may be that people sit with a situation, they've completed their advanced care planning processes 10 years ago, and they've not thought anything about it, and then suddenly a change happens, and it's looking for those trigger points. But I think it is good practice to point it to when situations are arising, or there's change in function for that person, or circumstances. Is 12 months? I think 12 months is yes, it's good if you've got that you've set up, but it doesn't mean that what that is the be all and end all. So again, it's very much dependent, and I think 12 months is an arbitrary figure. I think you need to look at what the circumstances are that dictates that situation change.
Wonderful. Thank you. There aren't any more questions through the chat, so we might close it up there. Thank you so much, Greg, for sharing your knowledge and wisdom with us today. Very much appreciate you, and appreciate everyone on the call here today. We will be sharing out the resources from today's session and the recording, so you can watch it back. And there'll be the contact details in there as well for you to reach out and get more information. Thank you very much, everyone, and look forward to seeing you at the next session.
Thank you. Take care. Bye.
Thank you. Bye-bye.